mentioned autonomic dysreflexia. Does Keith Morges, in your opinion, to reasonable degree of medical certainty, have autonomic dysreflexia?
I don't think he does, man.
And on what do you base that opinion?
Well, there's a number of reasons I think that. Number one, typically if you're going to have autonomic dysreflexia, and I don't know what, has that been explained here before? I don't want to follow the same field, but autonomic dysreflexia is essentially an outpouring of sympathetic nervous system, and it's a bad thing for the patient. Their blood pressures typically shoot up high. They can have a stroke. Their pulse can drop. They feel terrible. A lot of times they have a sense of, oh my God, I'm going to die. They literally feel that. And it typically occurs with a higher spinal cord injury, usually a really bad one, like a complete transection. And it's usually above the T6 level, of the spinal cord. And so, first off, that we don't have that. We don't have a catastrophic cord injury, and we don't have one up at that high level. That's the first thing. And then the second thing is, although I think this started around the time that some of the aerodynamic studies were done, he definitely had some distress during the bladder filling, and then he described some distress when his bladder was full. And I don't deny that he had distress, but he did not have signs and symptoms of autonomic dysreflexia. In other words, he didn't have the blood pressure and the pulse changes that I would expect with autonomic dysreflexia.
And have you reviewed the urodynamic study vital signs in this case?
I did, yes.
So let's look at these. Is there any significant change in heart rate or blood pressure that would be indicative of autonomic dysreflexia?
No, and actually, when I looked at this, my sense was that this actually, to me, says he doesn't have it, because I didn't see the changes that I would be looking for. Although we can see on the lower right-hand side, he's talking about some of the symptoms that he's having. He's feeling dizzy, sweating, nausea, and then the study was stopped. But it's interesting that really, in spite of having the sensations, there really isn't a dramatic change in blood pressure or pulse. It's actually pretty steady.
There's also been mention of the normal cystogram that was done in May, I believe, May 2011, and specifically that there were no trabeculations. Mm-hmm. Have you reviewed that cystogram?
Yes.
And tell us what a trabeculation is, whether or not, and why that's important or not to you.
Trabeculation refers to prominence of bladder muscle fibers, and it's something that we can see sometimes when we look into the bladder with something called a cystoscope. You can also see it on x-rays, like if you fill the bladder up with dye or contrast and take x-rays, you may see these little folds or prominent muscle fibers, and that's called trabeculation. It's not very specific, and it can be kind of deceiving. For instance, you may look into a person's bladder, and if you fill it up enough, it's nice and smooth and there's no trabeculation. But if the next person looks and they have like 100 cc's less in the bladder, you may see these little fibers. The other thing is, if you're looking in and the person has a bladder contraction, that will look like trabeculation. So it's very non-specific. It's a descriptive term that we use, but especially in its milder forms, it really doesn't mean anything.
And I want to ask you one more question about autonomic dysreflexia. We saw Dr. Shapiro testify to those, about those. He uses the term clinical autonomic dysreflexia. Do you recall seeing that?
Yes, sir, I recall seeing that.
In all of your education, training, and experience as a urologist in USC, have you ever heard of that diagnosis?
I have never heard that diagnosis, no.